As the 4th of July approaches, a lot of people will be blasting off fireworks, and doctors treat numerous injuries every year. The Consumer Product Safety Commission says 14% of firework injuries last year involved eyes. Dr. Amanda Salter is here with us now from Shanbom Eye Specialist in Berkeley with some tips to make sure that we are all safe this holiday. Good morning.
Thanks for having me.
So what kind of injuries do you normally see when it comes to fireworks and damaging the eyes?
So fireworks-related eye injuries can combine blunt force trauma, burn injuries, and chemical injuries. So, the degree of injury can really vary, but there's definite risk of really severe permanent damage to the eye and loss of vision. So it could be as simple as a scratch to the eye, or it could be as severe as what we call a ruptured globe, which is a cut in the eye.
And is there anything in particular that happens when we do hurt our eyes?
So again, that really can range as far as how severe it can be. But what I would say that's the most important point is if you have a fireworks related eye injury, it is an emergency. And so you do want to seek medical care right away. What you don't want to do is put any pressure on your eye. You don't want to rub your eye. You don't want to rinse your eye. You don't want to try to put any medications in your eye. And you definitely don't want to try to remove any foreign material from your eye.
So I feel like, there's all these different type of fireworks out there, right? And I always felt very comfortable with sparklers growing up because they felt just like a little bit less dangerous than an actual firework. Have you seen injuries because of sparklers?
Yes, so I agree with you. I grew up with sparklers too, and they seem safer. But in fact, they were right behind firecrackers as the reason for emergency room visits. And they do burn at extremely high temperatures of around 2,000 degrees Fahrenheit. So while we might think of them as being safer, they can definitely cause eye-related or other fireworks-related injuries. And we should really be keeping them away from small children.
So what should you do then to keep safe? How far away should you be standing from these fireworks? Should we be wearing goggles?
Yes, so great questions. So I'd say the main point is leave it to the professionals. So if you can find a local professional fireworks show and stay at least 500 feet away, and also, to your point of wearing goggles, more than half of fireworks-related injuries are actually from bystanders. So I would say yes, if you're in the proximity, you do want to wear eye protection.
And I know you kind of touched on this already, but is there any type of injury that you should treat at home comparing to go seeing your doctor?
I would say no, because sometimes it can be hard to tell how superficial an injury is. For eye-related injuries, you definitely do want to just seek medical attention rather than trying to fix it on your own. You could potentially make it worse, and we definitely don't want that.
And does that mean going straight into an emergency room? Are you talking, straight to the hospital, the ER, or just an urgent care? What kind of doctor should you go see? Because a lot of doctors' offices are probably going to be closed on the 4th of July.
Right. So yeah, I think any eye injury that's from a fireworks should be treated as an emergency. And so best is to probably go to the emergency room because as you say, obviously a lot of offices are closed and you definitely don't want to wait on that.
And don't drive yourself there. Hopefully there's someone with you around. But if you have an eye injury, definitely don't get behind the wheel of a car.
Good point.
All right, Dr. Salter, thank you so much for being here, providing a little bit of insight, something we can definitely keep in mind moving into the 4th of July weekend.
Thank you so much.